So talk about your chest binder, right?
Yeah.
When did you start wearing one?
Well, back when I was in Perth, I tried using like a sports bra and a compression shirt.
Okay.
And it worked okay, but it felt uncomfortable. And then my friend wanted to get a binder, and I was like, oh, yeah, I'd like a binder. I won't wear it all the time. Maybe I'll wear it for like cosplay or being a drag king. And so we could split the shipping. And then I put on the binder and was very, very happy.
Okay.
And that was it was in 2016.
Tell me why makes you happy?
I just liked how it looked and how it felt, and having like being able to like be flat.
Okay. So it's really it flattens everything without feeling uncomfortable?
It feels sort of uncomfortable, like I
You still feel uncomfortable?
Yeah, but it's a different kind of discomfort. So instead of feeling dysphoria, I have like muscle soreness.
Okay. How long you've been wearing the chest binder? Is it binder? Chest binder?
Yeah, usually we just shorten it to binder.
Okay.
Because it's the only kind of binder that we wear. Yeah, I don't know. I think I could look if I looked through my photos, but I could check.
1 year, 2 year?
I'd say over 1 year. I've been on testosterone for a year and a half, so maybe 2 years ago.
Because this is my curiosity, right?
Yeah.
Is it change how your breast shape? Because you know how you push and everything,
Yeah.
and then they will become different shape.
Alright, please just call it my chest.
Oh, sorry.
Okay.
You learned something, okay? I learned something, okay? Yeah.
I think.
You'd rather me don't use the word breast, you want me to use chest? Okay.
Yeah, it's quite a common hot tip.
Yes.
Yeah, most people don't most trans people who feel dysphoric about having a bigger chest prefer it just to be called the chest.
Okay. Yeah. So will that distort the shape and everything to make you don't even like the body more?
I mean, they also look different on testosterone.
Oh, really?
Yeah, because like if you have estrogen in your system, then everything looks kind of plump.
Okay.
Whereas if you have testosterone, it kind of looks like deflated.
Oh, really?
Yeah. So it's hard to tell like what's testosterone and what's the binder.
Okay.
Yeah, but I asked my surgeon, and she said it's fine because it's just like flattening the skin, not pulling it. But another way that I bind sometimes is tape.
Okay.
So you can get kinesiology tape or KT tape, and like put it here and stretch it around the back.
Okay.
And it pulls your chest out.
Yeah, you told me that because you use it during the sex time. the good time.
The good time. Yeah, it's nice because
But how about when you sweat?
It stays on pretty well. I tried to wear tape to what's it called? Hot springs. The hot springs.
Oh, really?
Yeah, and then they came off.
Okay.
But I've used it going to the beach before.
Okay.
And that works fine, except
you going to the beach topless?
Yeah, with tape.
With tape?
Yeah.
Wow, okay.
Yeah. It looks pretty flat. So it just looks like I hurt myself and I have a sports injury.
Okay. I can imagine. I cannot ask you to show me right now.
Well, it's on my Instagram.
Oh, really?
Yeah.
Okay, so we can check it out.
Yeah.
Okay. For this interview, there is something very important, which is talking about your surgery.
Oh, yeah.
What is this called?
Well, the slang is top surgery.
Okay.
Yeah.
Top surgery.
Yeah.
Because I thought I will do less video, but sometime I want to talk to this person and probably I will talk to them again. So I want to do this because so maybe next year we can do another video after you have your surgery.
Yeah.
What can you tell us about the surgery?
What do you want to know?
Expensive or not?
Oh, I mean, yes. Yeah, I think, I'm happy to say it's like the actual surgery is about $6,000.
Okay.
Yeah.
And then Australia.
Yeah. And I'm going to Sydney. And I also want some friends to come with me so they can take care of me. So I'm going to pay for accommodation and they'll cook for me. This is the plan.
Who is the doctor, may I know?
What's her name? Megan Hassel.
Okay, I don't know the doctor.
Yeah.
Okay. Is $6,000 an average price?
It's actually pretty cheap.
Okay.
Yeah. But
What is expensive then?
I'd say like $15,000.
Okay.
Yeah.
Why choose this doctor?
Well, mostly because I've seen, so I have quite a small chest. You can't see it now because I'm wearing a binder, but so I qualify for a kind of surgery where instead of having the scars here or here, the long ones, I'll just have like little scars around the nipple.
Really?
Yeah.
Okay.
And
So okay. I'm a trans woman.
Yeah.
And I always have this idea, trans guy and trans woman are totally different.
Yeah.
I mean, even though sometimes we have a little bit of same experience, but we are different, and the surgery we're going for as well. Tell me more. After I say that,
Okay.
I want to learn.
Okay,
yeah.
cool. So,
So how many way can you have the surgery?
plenty. So,
Oh really? I didn't know.
I mean, like, the main two ways is double incision,
Okay.
which is otherwise known as DI,
Okay.
and that's where you have the long one, so
Yep.
like 2 incisions.
What is the good thing to have the surgery? What is the benefit to have such a long scar?
Well, some people can only get that if they have a bigger chest.
Okay.
It also means that. Whoops. It also means that only people with quite small chests can get what I'm getting, which is usually known as peri-areola.
That is what you're getting?
Yeah, or peri for short, and it means like you get halfway around your areola.
Okay.
And
So the scar will look like
just like a very thin white line if everything goes well.
wow.
Yeah,
Okay.
it's called. So yeah, it'll just look very faint. People have different techniques.
Yes.
Sometimes people get T-anchor surgery, but it's not very common. That's more for breast reduction.
Okay.
So that's when you have a scar and a scar.
Like T-shape.
Yeah, a T, yeah. But yeah, and then double incision, like some people are too big to get, some people are too big to get peri, or they don't mind the scars. And peri, if you've got a bigger chest, can sometimes give bad results,
Okay.
or they don't get rid of enough skin.
Okay. So you mean have something like a man boobs if you don't get enough?
It's less like man boobs and more like loose skin.
Okay.
Yeah. Or they just can't take it down that much. So yeah, I guess. And it doesn't look like flat and nice,
Okay.
in my opinion. But I do want to say about kinesiology tape. I asked my surgeon whether it's okay, and she said it's okay to wear it, but when you take it off, it will pull the skin,
Okay.
and you need to have like tight, elastic skin for the surgery that I want.
Okay.
So she told me to put what's it called? Tea tree oil
Okay.
or eucalyptus on there, or this other stuff I forget, and that will make the glue in the tape dissolve,
Okay.
and then you can just pull it off so it doesn't pull your skin.
Yeah. Okay.
Yeah.
Wow. Hot tips.
Yeah.
What is it always 100% successful rate for the top surgery?
No.
Oh, what?
I mean, it depends what people define as success.
Okay.
So a few things that can go wrong are
What is the thing that goes wrong?
Well, sometimes people's nipples fall off.
Fall off? What do you mean?
So it depends what kind of surgery you get and your body and everything. Mine will probably stay because I'm just getting a cut around the top.
Oh, yeah.
But sometimes, especially if typically like people assigned female at birth or people with breasts have nipples in the middle, and typically people with flat chests have nipples further to the side.
Okay.
So sometimes people will take off the nipple,
Okay.
do double incision,
Okay.
put the nipple back on.
Repositions it.
Yeah.
Yeah, same as breast implant. If
Yeah.
you have something really humongous, you have to reposition it.
Yeah, exactly. So sometimes when you put it back on, it doesn't stay, and one or more will fall off.
Wow.
Yeah, die and fall off. Sometimes people get dog ears.
What's that?
Dog ears.
What does that mean?
It's when you get double incision.
Okay.
Sometimes the end ends in a bit of skin like this.
Okay.
Yeah, so that's called a dog ear.
Can you do another surgery?
Yeah, so you can get a revision and get rid of it, but sometimes the surgeon wanted to stop there so the scar doesn't go all the way around.
Yeah.
But some people don't mind. They're like, this is my body, whatever.
Yeah.
It's flat now. I don't mind, I love it.
Okay.
Yeah, what else can go wrong?
Anything might go wrong for you because you choose a different type, right?
Yeah, so for me, if people have bigger chests and choose my kind of surgery, sometimes there's puckering.
Okay. Yeah.
Because it's like you have a draw.
Too much.
It's like a drawstring bag. So you know when you have a bag and it's wide and then you pull the string and it goes.
Yeah.
That's what they're doing. So when that happens, sometimes there's puckers.
Yeah.
And there's always the risk of, and sometimes the skin isn't elastic enough.
Okay.
It's too loose, so it just looks a bit like floppy.
Okay.
Like they take out the tissue but not enough skin.
Yeah.
So then you just get skin. Another one is, I think it's called a hematoma.
Okay.
Where you get like a lot of blood stopped or something, and it like there's a lot of blood stuck in one spot.
Okay.
So they need to put you back under and take out the blood.
Oh my god. But how about you? What is your doctor warn you?
Apparently, like my chest is small, my elasticity is good, my muscles are good, so my results will probably be good.
Okay.
But yay!
Better, right?
Or what I want anyway. But they I could get like a hematoma, or I could have scarring that's red, or what they call keloid scarring.
Oh yeah. But you scar easily?
I don't know. This is the first surgery I've ever had.
Okay.
But I don't hurt myself often, so not sure.
But you're looking forward for it, right?
Yes. Well, I'm not looking forward to surgery. I'm looking forward to after surgery.
Without the binder, don't have to wear the binder anymore.
Well, actually, after surgery, you need to wear a different kind of binder.
For how long?
I'm not sure, but maybe like a week.
Okay, just a week. You can wait just one more week. And then you can be topless or go anywhere you want.
Or sometimes a few weeks, we'll see. Or it might look like bruised or puffy or scars.
Top surgery. Any more surgery?
Not now.
What is other surgery that you can do as a trans man?
Okay, so, well...
I mean, other than, the obvious, the sex reassignment, but how about, is it like the face you can put things here, put plastic?
It does exist, but I've never seen someone to actually do it.
Okay.
But also testosterone is really powerful.
Okay.
So, my face has changed a lot just from hormones.
Okay.
I think, people say that testosterone is, stronger than estrogen. So going through testosterone-based puberty will change you a lot. And I know, FFS is a thing for trans women if they want that.
Oh, yes,
Facial feminization
Yeah.
surgery. Yeah, and I've seen like Steph Sanyadi is a YouTuber who documented her process of that.
Okay.
But yeah, I haven't seen like facial masculinizing surgery. But you can get like manscaping.
Okay.
Or when you take fat away from the hips. And sometimes people put it like back here, so you have more of a shape.
Okay, and six pack.
I don't think it's a surgery for that.
No, there is.
Really?
Yeah, they sculpt your abs.
Oh, that's
or they
funny.
inject fat as well. Yeah, so you got
Really?
six pack. Yeah.
Oh my God. Yeah, lower surgery. There's actually two main types. There's like phalloplasty or metoidioplasty.
Okay.
So like phalloplasty, they get a skin from a donor site and then construct a phallus with that, and you can have balls or not, and like close up stuff or not.
Do you want to do that?
Probably not.
Okay.
There's also metoidioplasty, which you just work with what you've got. So in testosterone, like the part that you already have grows.
Yes.
Yeah. So you can add balls to that or just release the ligaments.
Yeah. But you don't want to do any of that.
I might just get a really simple snip.
Okay.
I'm not sure about the future, but part of it is that phalloplasty is really, really expensive.
Okay.
It's like 50 grand, something like that.
I actually talk about this topic as well, you know, because I feel like, you know, for trans women,
Yeah.
a lot of them will go all the way down.
Yeah.
Because the offer is there.
Yeah.
So you have the money, you can go all the way there.
Yeah.
And sometimes for trans men, it feel like, well,
Technology is.
it's not there yet.
I think like you can get really good results, and some people need that, and like are very
to
happy.
feel complete.
Yeah, and like to be happy with their lives, to be able to use a urinal really easily,
Yeah.
obviously for sex too. A lot of people just want to stand to pee. It's a big thing for some people. Yeah, but there's no like perfect, in my opinion, perfect surgery where you can either have a phallus that's really big all the time or something that's small all the time.
Yeah.
Yeah.
What is your message for this or for our audience?
I was trying to think about this before. I think that like trans people exist, and sometimes like people who haven't encountered trans people before don't know what to do and feel a bit confused or intimidated or not sure how to treat people or what to understand. And I think sometimes people like to know how the world works. So when there's a trans person saying, actually that's not how the world works, then they get a bit off kilter.
Yeah.
I'd say like try, if you want to interact with us, like just try and learn, and sometimes learning will be a little bit uncomfortable, but that's okay. And my tips are also, it's fine to be curious, but if you're asking a question of a trans person on how, like for them, so you know how to address them, you know what name they want, what pronoun they want, what nouns like boy, girl they want for them, then those are really good questions. But if you want information because you're curious and for you, then find another resource. Ask if it's okay first. Watch interviews like this one on YouTube.
Or don't be too defensive when they correct you.
Yeah.
Like before, you know, you said this is a chess, you know.
Yeah.
I said, okay.
Exactly.
You know,
like, oh, I'm learning something. Let's do it.
Yeah. And you have to say like, oh, thank you, you know.
Totally.
Don't be like, you know, what are you talking about, you know.
Yeah.
Who you think you are?
Yeah. Yeah, or like, I call a spade is the expression. Yeah, I think that would be it.
Okay, good. Oh, when are you going to do the surgery?
December. The start of December.
So we probably will do another interview. who knows something else came. Oh my God, we probably want to do a music video as well.
Oh yeah, yeah.
So people, you're gonna see more of Shae. So but maybe don't have to wait until next year.
Yeah.
Okay. Thank you so much.
Thank you.
Yes, keep up. Oh, and thank you so much, teach me about the dating, because at that time when you do this, you are so friendly, and I feel, even though, I'm part of the community,
Yeah.
but at that event, I feel like, oh my God, it's welcoming, this very good of you.
Thank you. Well, thanks for responding so well. I was like, oh, she just was like, oh, I didn't know. What should I call them? Great, I'll do that. Like,
Yeah. I know I'm a good person.
Yeah,
The best. All right, everyone. Thank you for watching. Bye.
Tell me what you want, what you want. If you want my future, you get my past. If you wanna get with me, better make it last. I'll go wasting my precious time. Get your act together, it could be just fine.